In this whole process, we tried to keep the industries with higher risk settings open, namely F&Bs and gyms. But because of this significant shift in public health situation, the MTF needs to rethink our posture. What are our key considerations? Let me explain. Number one, from MOH perspective, our hospital capacity, which must be protected. Once that is under pressure or overwhelmed, we will have a disaster, and many people, patients, will all be affected. But as of now, as I explained in our press conference last week, we are still okay. We still have headroom. We can still rev up our capacity, which we are activating, and we still have that headroom to withstand the pressure. But if the cases keep on rising or keep at today's level and carry on for a couple of weeks, it can come under significant pressure. We don't want to take that for granted, and we need to protect our hospitals and patients, even though as of now, as I explained last week, we are still in an okay position, but don't take that for granted. Second consideration is vaccination. As of end of yesterday, I'm happy to say we have crossed 50% of our population having received both doses and completed their regime, their vaccination regime. But there remains over 100,000 unvaccinated seniors over 70 years old. And if you add those that's above 60 years old, there's another 100,000 or so. There's altogether 200,000 above 60 years old. And they have a high likelihood of falling critically ill once infected. Almost every one of them, if infected, will end up in hospital because they are high risk, and 10 to 15% of them, based on our experience, will end up in ICU. So imagine 200,000 people. If we have widespread infection, just 10% of them, let's say 10% of them get infected, that's 20,000. All 20,000 will be in hospital. Amongst them, 10 to 15%, that's 2,000 to 3,000, will end up in ICU. It's huge, huge number. The last consideration I mentioned is community exposure. So as I mentioned, unlike the KTV cluster, which has spread amongst younger population and amongst a certain network of people, this wave of infection affects the markets and our food centers and affects a much wider spectrum of our population, including our seniors, especially our seniors. And the porous nature of our food centers and our hawker centers also increases the risk of cryptic and silent transmission that is hard to detect. Hence, after thinking long and hard, we decided we have to revert to phase 2 heightened alert. It is most unsettling for the affected industries and the establishments. But, we are so close, weeks away, to a stage where we have 2/3 or more of our population fully vaccinated around National Day, and then being able to much more decisively transit to a COVID-resilient posture. We are so close, weeks away. And so therefore, now is really not the time to risk it all. So we need to bite this bullet, dial back on social activities, and then use this time, push through the vaccination efforts. We're now doing 80,000 a day, almost every day, with 70 to 75% dedicated to second doses, helping many more individuals complete their doses and their regime. And these few weeks, go all out, reach out to the seniors and try to vaccinate them. We have reached out to GPs for your help, because we know many seniors, they're not going to listen to ministers, but they may listen to their doctors and their GPs. So help us call them, persuade them that it's better for you to get vaccinated. And when we reach a much more resilient stage with a much higher percentage of our population fully vaccinated, we can then reopen industries, and with the confidence that even if cases rise to the level today, 100, 200 cases a day, or even higher, we know we can stay safe and allow businesses to continue operating, and life can go on. And at that stage, we will then move on to tackle and help the sectors that actually have not even smelled any sign of recovery, and that is tourism, that is aviation. We've been talking about F&B and gyms, but these two sectors are not even smelling any recovery. But we will reach there, and we'll start looking at helping those sectors recover. They have not been forgotten.